Also, as we talk about unity in our community, part of that comes into fold as we try to help others who are in need, especially at this time of the year, as September is National Recovery Month, as we help those that have been afflicted with substance use disorders or addiction, whether currently or in the past, or they are in active recovery. There are resources across Greater West Bloomfield and beyond that are at their disposal as we recognize National Recovery Month and beyond September also. Joining us now from the Alliance of Coalitions for Healthy Communities to tell us more about these resources is peer navigator Pepper Catt. Thank you so much for being with us today.
Good morning. Thanks for having me.
Glad to have you on as we recognize National Recovery Month, which is a really important time of the year where we think about all the different elements that go into that recovery for those that are afflicted with substance use or misuse or addiction, however it is verbalized in our community. Just how much of an effort goes into helping these individuals find these resources and then ultimately help them maintain their recovery over time?
Yeah, we're learning it's a real team effort. We don't just want the resources coming from one place. We need the whole community in on it to make sure that people aren't falling through the cracks, make sure that whether they're at a doctor's office or a treatment center, or maybe they had some type of run-in with law enforcement, that those resources are available to them and that we're all working together.
And the Alliance of Coalitions for Healthy Communities, otherwise known more simply by shorthand in our community as the Alliance, they do a lot of that groundwork all throughout the year. What are some of the ways that you do get out on the ground in communities like ours and beyond in our local area to help people who are facing these issues?
Yeah, we're actually a really cool coalition. So it's the Alliance of Coalitions for Healthy Communities. It is a long title there. We're kind of like an umbrella coalition. So we work with coalitions in cities throughout our county. And what we do is we come out and we do prevention, we do wellness, we do recovery support. So we're going into schools, we're going into nursing and retirement homes. We're trying to educate people before they fall into a substance or alcohol use pattern. We're also going into treatment centers and hospitals. We have Save a Life stations, which distribute free naloxone to the county. We do Narcan, naloxone trainings. We're really just trying to break the stigma and get the word out there.
And Pepper Catt is with us from the Alliance of Coalitions for Healthy Communities, one of their peer navigators on today's edition of the Splash Live. And as we talk about these resources and these intervention opportunities that are available through the Alliance and through all these coalitions in our communities, people from the outside looking in may question, how much do these actually work? And you have a unique perspective on that because you've seen firsthand how these programs can help people. What are some examples of ways that these resources have helped people with substance use disorders right here in Greater West Bloomfield and beyond?
Yeah, so one of the coolest things we're doing is the Alliance partners with the Oakland County Sheriff's Office. We're part of the Crisis Response Unit, which is coming up on almost 2 years old now. So we work with law enforcement. We are crisis intervention trained. We're trained in harm reduction. And we work hand in hand with law enforcement to make contact with people in the community that have maybe overdosed or ended up in the hospital due to drugs or alcohol. And then we meet them where they're at, which means we introduce them to resources. We talk to them about recovery. We talk to them about assistance that's out there. We really see what their needs are and where we can help them with that. The Crisis Response Unit deals with substance use and mental health. So we make sure that they're connected with the proper therapists and doctors. Like I said, the treatments, make sure treatment centers are easily available. Help them with the process if they need help accessing their insurance or getting into centers. So we do a full, circle of trying to make sure all needs are met, whether it's housing, transportation, mental health, addiction.
And luckily nowadays we're more aware of some of the problems or outside issues that ultimately can lead people into these substance use disorders or these issues where they have to seek this sort of recovery. I recently had an operation where for for pain. Afterward, they had prescribed me some opiates, and they gave a full-fledged education about how to take them, how to store them, what to do with them when you're ultimately done and no longer in need of them. And that education is really important, but also having additional resources throughout our community so that people are aware of what they can do to help intervene and possibly save a life. And here in Greater West Bloomfield, we are a part of that unique opportunity, along with the Alliance of Coalitions and some of those resources you talked about earlier, to have some of those provisions in place in a variety of different areas across our community, both on education and things that help them take action. Can you give us a little bit of insight on what those resources are and where people may find them throughout our communities?
Yeah, so in West Bloomfield alone, we have 10 Save a Life stations. A Save a Life station is it's a big box. It's free. You can open it up, and then inside that we have naloxone. So you can take naloxone for free. We also have resource cards in there. We have fentanyl and xylazine testing strips in some of the locations to help keep people safe and know what they're ingesting. But the naloxone is what I really believe is, helping the community. We had a 3% decrease in overdose fatalities this past year. And this next year, we're hoping that number is even bigger. Naloxone is really easy to use. It's a nasal spray. It's a opiate reversal medication. So getting the education out there, teaching people how to administer it, making sure people know it's okay to carry around. It's a very safe medication. And I think that's one of the main reasons that we're saving lives out there, and we're starting to see a change. And so many people I talk to, their addiction started with a prescription from their doctor. So I'm glad to hear that they're educating people now and, trying to educate and get on that end too before they come into needing services from someone like me.
Yeah, and kind of having that across the board education and those across the board resources in place to help both on prevention and on intervention, and in between, those bystanders playing a key role that could potentially save lives in our community. We're joined by Catt, who is a peer navigator at the Alliance of Coalitions for Healthy Communities. You can find more information on their resources, including the locations of those Save a Life boxes in West Bloomfield, across Greater West Bloomfield, and around southeastern Michigan, achcmi.org or alliancemi.org. You can also find them on both Facebook and on Instagram at Alliance of Coalitions. And Pepper, you mentioned earlier on some partnerships with the Oakland County Sheriff's Office to help in prevention and intervention. Overall, across the board, as you partner with law enforcement on prevention and ultimately intervening when someone who's experiencing an overdose is either apprehended or is encountered by law enforcement during an emergency stop, with first responders. How does that factor into preventing people from either entering into further addiction issues or getting them the treatment that they need without that fear that they're going to be punished by coming forth to people in our community and seeking these resources?
Yeah, I think that the crisis response unit, our connection with them, us, people with lived experience working with law enforcement, I think that's changing the stigma in the county for sure. Like I mentioned, the law enforcement officers that we work with and us with the lived experience, we're all trained in crisis intervention, de-escalation tactics, motivational interviewing. What we're really wanting to do is to let people know that law enforcement are humans that are trying to do their job, and us in recovery, we're also humans that have been stuck in a cycle, of self-medication, usually because we can't deal with some type of pain in our life. So this partnership, working together, introducing the people in the community to law enforcement with no intention of any type of criminal justice type actions, just really wanting to help, really wanting to support, changing the dynamics so that everyone knows that this is a mental health crisis. Addiction has touched all of us. I don't think I know anyone that hasn't been affected by addiction or some type of mental health crisis. So just all coming together and working hand in hand is going to change the way that we look at people that are using substances to make themselves feel better.
As we recognize National Recovery Month, important to know where these resources are available for you and yours in their community, or even others that you may encounter that perhaps have some of these issues in their lives and could use some of these resources and these connections to help resolve those issues or to intervene during September and beyond. Pepper Catt is with us from the Alliance of Coalitions for Healthy Communities on today's edition of The Splash Live. More information on the resources and services at alliancemi.org. Pepper, finally, before I let you go, I do want to touch on this because Michigan's been part of an opioid settlement from the drug companies where they're set to receive $1.6 billion in a national settlement that's yet to be fully allocated to local communities, but we know that those resources are coming. How do you believe that's also going to play a factor in local alliances and other organizations, along with public and government organizations, ultimately being able to ramp up these prevention and intervention efforts across our local area?
I mean, I really hope that it is put to transportation and housing. I know the housing crisis is just getting worse. We're going to have a lot of people that need somewhere to go. You know, that's one of the main things with mental health and substance use. If you don't have a place to lay your head at night, that adds, a instability that really hinders your life. It makes it really hard to break that cycle. So I'm really hoping to see more transportation, more affordable housing, and then more programs that we can do warm handoffs. So basically working together in the community. So say someone's at their doctor and they need to go to a psychiatrist, instead of just handing them a referral, there's some type of peer navigator to help them make that appointment, to actually follow through and to get that next appointment so that people aren't getting lost in the process.
More information and resources available on alliancemi.org, or you can follow them on Facebook and on Instagram at Alliance of Coalitions. Pepper, before we let you go, if people are in need of some of these different communications or of these resources for intervention in our community, they want to reach out, what's the best way for them to do that from either the Alliance of Coalitions or their local coalition?
So you can definitely go to our website, alliancemi.org. All of our contact information, everybody at the company is on the website. We could also connect with your local coalition if that's something that you would like. All the Save a Life stations have resource packs in them. And then the crisis response unit now has a 24-hour number too that I can give you 24 hours a day. If someone is in a crisis, they can call this number. It's 248-463-5111. Again, that's a new 24-hour number we have here in Oakland County for the crisis response unit, and they can reach us that way too if they can't find us on the website.
One more time, 248-463-5111 is that crisis phone number. Pepper, thank you so much for your time today.
Thanks so much for having me.